A chemical pregnancy, or biochemical pregnancy, is a very early miscarriage that happens within the first 5 weeks of pregnancy, before the pregnancy can be seen on an ultrasound. An embryo forms and implants in your uterine lining, but then it stops developing. Chemical pregnancies occur so early that many people don't realize they've miscarried. Having one chemical pregnancy doesn't mean you can't carry a baby to term, though. Many people who've experienced early miscarriages go on to have successful pregnancies. Chemical pregnancies get their name from the hormones that produce a positive result on a pregnancy test. Within the first 5 weeks, the embryo will produce human chorionic gonadotrophic HCG. Your HCG hormone levels provide the only real clue that you're pregnant at this point, because it's too early to see signs of the fetus on an ultrasound. But once the embryo stops developing, your HCG levels fall. With a clinical pregnancy, your HCG levels rise steadily. Your healthcare provider uses the term clinical pregnancy when they confirm a pregnancy with chemical evidence positive urine or blood test, or by being able to see signs of the fetus on an ultrasound. Signs and symptoms. Your period comes about a week later than usual. You have a positive pregnancy test, but then you get your period. You have a positive pregnancy test, and then a negative pregnancy test a few weeks later. You have a positive pregnancy test, but you don't notice the usual signs of early pregnancy. What does chemical pregnancy bleeding look like? The bleeding from a chemical pregnancy can look and feel different for everyone. Your period may feel normal, or you may notice that it's heavier than usual and causing you to cramp more. Sometimes, the bleeding begins as spotting and then gets really heavy. With blood clots, a chemical pregnancy happens within the first week of implantation. Implantation is when the fertilized egg implants in your uterine wall and turns into an embryo. This triggers your body to create HCG, a hormone that helps the embryo grow. It's also the hormone that pregnancy tests check for to see if you're pregnant. But then the embryo stops developing, usually within a few days. But since HCG is in your bloodstream, it can show up as a positive pregnancy test. It can take several days or weeks for HCG levels to go back down. No one knows exactly why an embryo stops developing during a chemical pregnancy. Likely, the embryo stops developing because of a problem in its genetic makeup or DNA. Sometimes, in the uterine lining the way it needs to in order to grow. But once your HCG levels drop below a certain point, a pregnancy test will come back negative. Who do chemical pregnancies affect? You're 35 or older. You have an irregularly shaped uterus. Your hormone levels are too high or too low. You have a sexually transmitted infection STI. You have thyroid disorders, diabetes, or polycystic ovary syndrome PCOS. An embryo doesn't take hold or implant